Hello, I'm Dr. Stile. If you're watching this, you've either just completed your surgery or your procedure is about to begin. This center is a freestanding ambulatory surgery center licensed by the state of Nevada for outpatient surgical procedures. The center is also federally regulated and accredited by the Joint Commission, or JCO. The center is inspected twice each year to assure our patients that we meet the highest standards for safety, equipment, and personnel. Your anesthesia and comfort control will be provided by a medical doctor who is certified by the American Board of Anesthesia. The nurses that are caring for you are highly skilled and experienced registered nurses. Everything we do here is to ensure your optimal safety and comfort. Prior to your procedure today, you will be required to complete intake questionnaires and consents for anesthesia. Your nurse will perform a brief physical exam and start your IV. Your anesthesiologist will next discuss your medical history, examine your airway, and listen to your lungs. I will then discuss your planned procedure with you once again, draw your surgical plan, and answer any questions you or your family members may have about your surgery. Our OR team will next take you to the operating room where you'll be transferred from the gurney onto the operating table. You will then receive medication via your IV to help you relax, and monitoring equipment will be placed. Your anesthesia will next be administered and your procedure will be performed. Upon completion of your surgery, you'll be returned to the post-anesthesia care unit, or PACU, where your nurse will resume your care and help with your comfort and recovery. Your legs will be elevated using pillows and your knees will be in the bent position. This will ensure good circulation. Your head and back will also be elevated. This will minimize swelling and tension at the operative sites. If your surgery required the placement of Jackson Pratt drains, you will be instructed on their care several times before your surgery and prior to your discharge home. You will remain here until you are stable for discharge. You will be ready to go when you are alert and oriented and the effects of anesthesia have worn off. When your vital signs are stable, you can tolerate liquids, ambulate under your own power with assistance, and use the restroom. You'll be ready to go. Once you are discharged with your caretaker, you will return to the same position, head and leg elevation with knees bent, in your own bed or recliner. It may be a good idea to have chucks or absorbent towels placed on your bed prior to your arrival to minimize soiling. At home, I want you to have a restful recovery, but I do want you to get out of bed with assistance every 2 or 3 hours. Do not use your arms to assist you, especially if you had a breast augmentation surgery. Your caretaker should help you up as demonstrated here. While in bed, it's important to flex and extend your feet at your ankles to help with circulation. You should take your medications on schedule. You must take your medications with food to minimize the chance of nausea. You can start with liquids and advance your diet as tolerated. If you feel nausea, you should use the Phenergan suppositories as instructed to help alleviate these symptoms and avoid vomiting. If at any time after your discharge from this center you have any questions or concerns regarding your surgery or post-op instructions, please call me at area code 702-243-9555. After hours, our answering service will take your call and connect you directly to me. I am available to you 24 hours for all questions relating to your surgery and care. Thank you.